This is Jagoda. She is an 82-year-old widow. Jagoda lives alone and has many health issues that are concerning in her ability to self-manage. A phone call from Jagoda's daughter has highlighted the need for more support and involvement in her mother's health care. Jagoda's wish is to continue to live independently in her own home. Since her husband's death, she has lost her outgoing personality and is now anxious and worried. Jagoda is motivated to spend time with her grandchildren before they grow up and look after her beloved dog. Jagoda's GP completes an at-home medical assessment. Jagoda has decreased mobility and stability with associated falls risk, difficulty with daily living activities, poor pain management, deteriorating eye health, and a possible stroke. This complicated medical history has led to Jagoda taking many medications, leading to additional healthcare concerns. Jagoda's past personal history, reduced social activity with friends, and rocky relationship with her family are negatively affecting her health. The GP realizes that facilitating independent living will take a multidisciplinary approach. She assembles a healthcare team to discuss Jagoda's challenges and create a collaborative plan. The team includes a pharmacist, a community nurse, speech pathologist, dentist, and a radiographer, with Jagoda's GP acting as a central liaison person to coordinate a holistic approach to her care. In order to facilitate independent living and manage Jagoda's health, the team decides a home medicine review is necessary. The pharmacist alters the medication to address her main concerns of therapeutic effectiveness, polypharmacy, and possible side effects. She also mentions that Jagoda's compliance and understanding of these medications may influence her health outcomes. The nurse volunteers to check Jagoda's Webster packs during her regular home visits to help the pharmacist ensure safe and effective use of the medications. The dentist brought up her concern that Jagoda's medications are causing a dry mouth, thereby putting Jagoda's oral health at risk. She agrees that addressing the polypharmacy may improve the hyposalivation and would like to see Jagoda in her clinic for a complete oral examination and to provide any treatment necessary. Jagoda's history of injuries, reduced mobility, and fear of falling, in combination with her living arrangements, have resulted in her becoming at high risk of falls. The nurse offers to address this risk and assist Jagoda with strategies for personal hygiene and general care. Her GP plans a physical assessment to investigate for any undiagnosed injuries which would warrant imaging by the radiology department. Neuroimaging is suggested by the radiographer to confirm a previously suspected stroke and possible extent of the injury. Both the GP and the speech pathologist agree this information will help them plan strategies to address Jagoda's difficulty in both her speech clarity and word finding. The team decides to refer Jagoda to several other allied health members in an effort to provide optimal health care and further assist Jagoda in reaching her goals. This includes an occupational therapist, physiotherapist, exercise physiologist, dietitian, optometrist, podiatrist, and social worker. Referral to a psychiatrist may help resolve any issues related to her strained relationships, difficulty sleeping, and also a social history which involves her mistreatment as a child in a European concentration camp. The main objective of the team is to deliver optimal health care to Jagoda in alignment with her aims and her situation. It would involve creating a manageable plan to assist Jagoda to independently live at home, manage her health, and improve her quality of life. This plan relies not only on the involved health professionals, but also on support from Jagoda's family. Jagoda has made it clear that she wants more family time. However, due to her children's circumstances, this may not be possible. Facilitating a family meeting to define the level of care required for Jagoda, both currently and in the future, will help Jagoda and her family improve their communication, lay out their expectations, and reach a compromise. In this meeting, the GP can work with Jagoda and her family in establishing the Advanced Care Directive. Once a plan is established, the initial home visit will involve modifying Jagoda's home and developing exercises to improve Jagoda's mobility and reduce the risk of falls. Following this, frequent home visits to review Jagoda's progress will be highly beneficial. This will ascertain if aspects of the plan are working and what requires reevaluation and modification by her multidisciplinary team. A fundamental aspect of high-quality healthcare is to ensure the patient feels supported and cared for. For Jagoda, this includes phone calls to inquire about her well-being, as well as provides a medium to give encouragement and reassurance. This also acts as an early detection method to address any developing or evolving concerns. A holistic and multidisciplinary approach is required to support Jagoda's desire to remain independent. For the healthcare team, this requires effective communication and the understanding that each patient and their surroundings are unique. With this plan, Jagoda can hopefully be seen happily living independently, being involved in her community, and maintaining her autonomy with such simple tasks as caring for her dog.